Increased blood viscosity is one of the main risk factors of the development of cardiovascular diseases. So what does the expression thick blood mean? Increased blood viscosity is often found in patients with obesity or metabolic syndrome. Blood viscosity also depends on plasma viscosity, red blood cell rigidity, and hematocrit. By contrast, plasma viscosity is affected by dyslipidemia, insulin resistance, inflammation, and plasma fibrinogen. Usually, the main cause of increased blood viscosity is malnutrition, from which a person does not get enough micronutrients or gets too much of them. So what are the most harmful foods for the blood? What foods thicken the blood, and what foods have the opposite effect? Before we answer these questions, please subscribe to the channel to get notifications about our new videos. We're doing our best to create interesting content for you. The appearance of blood clots in the vessels leads to a high mortality rate among all those suffering from this problem. Blood clots are one of the most common complications in severe COVID-19. What are the consequences of blood clots? Venous thrombosis is thrombosis in a vein caused by a thrombus or blood clot. The most common form of venous thrombosis is a deep vein thrombosis when a blood clot forms in the deep veins of the leg. If the thrombus breaks off and flows towards the lungs, it can become a pulmonary embolism. This combination is called venous thromboembolism. Various other forms of venous thrombosis also exist. Some of these can also lead to pulmonary embolism. Thrombosis does not always disappear completely, and after the illness, the patient may develop post-thrombotic disease that causes swelling of the arms and legs and the formation of trophic ulcers. Things you should know about blood viscosity. An interesting theory proposes that watering down your blood can prevent heart disease. The old adage, blood is thicker than water, makes sense for family ties. For the heart and circulatory system, though, a thinner, more watery blood might be better. Some tantalizing threads of evidence suggest that people with thicker or more viscous blood have higher chances of developing heart disease or having a heart attack or stroke. Viscosity measures a fluid resistance to flow. Honey, for example, is more viscous than water. The more viscous the blood, the harder the heart must work to move it around the body, and the more likely it is to form clots inside arteries and veins. How to check your blood viscosity? The easiest way is to make tests for the hematocrit number. It will show the ratio of blood cells to plasma. This procedure can be carried out in almost any hospital. The normal value of this index differs depending on sex and age of the person. The average number is about 35 to 45, but in young children it can reach 65. Significant deviations from the norm will show the blood imbalance, so you will need to carry out a more detailed test and contact a specialist. Normal condition of the blood. Good consistency of blood is a guarantee of the circulatory system health, and food products you consume influence it greatly. Some of them thin the blood, and others increase the viscosity. In case of thrombosis, the last type of foods may be dangerous. They will contribute to the formation of blood clots and worsen the person's condition. Of course, blood clotting plays an important role in wound healing, but in the 21st century, a person does not need to hunt for food, and the risk of injury for an adult is small. And blood clots may even lead to death, so you need to know what foods can help in thinning the blood. High viscosity is associated with poor nutrition. A high content of cholesterol, fat, glucose, and platelets in your diet is a guarantee of blood clots formation. So the very first thing you need to do to protect yourself from cardiovascular diseases is to change your diet. A nutritious diet is vital to your health. Feeding your body all the nutrients it needs not only prevents illness and disease, but also keeps your body and its organs functioning like a well-tuned machine that it is. People who have certain medical conditions such as congenital heart defects may require blood-thinning medications to reduce their risk of heart attack and stroke. It's essential to talk to a doctor before trying these remedies, as they may not work as well as medication and may interfere with some prescription drugs. Here are some of the food products and other substances that may act as natural blood thinners and help reduce the risk of clots. Let's take a look at the top 10 foods that thicken the blood: liver, kidneys, and hearts. Doctors recommend eating liver to improve blood flow, but in large amounts it increases hemoglobin levels greatly and causes the formation of platelets in the blood. Buckwheat. It improves blood clotting, but eating too much of it may worsen the condition of patients with thrombosis. Buckwheat contains a lot of iron, which increases the level of hemoglobin, and lecithin, which affects the blood viscosity. Walnuts. Walnuts contain many tannin compounds that make the blood very dense and viscous. You should not give up nuts at all, since they contain beneficial omega-3 fatty acids that remove cholesterol from the body. However, you should consume them in moderation. Legumes. Beans are loaded with plant-based proteins that increase blood viscosity. Beans and peas are strictly contraindicated in case of high blood pressure. Bananas. Bananas are high in sugar, which increases the glucose level, and as we know, glucose turns into lipids in the body over time. Lipids in turn thicken the blood very quickly. Potatoes. Everyone loves potatoes, and so many people know that it consists of starch that breaks down into carbohydrates and increases the sugar level in the body. You should consider giving up fried potatoes as they contain fats that bring no benefits to the body. Green herbs. Parsley and dill provide us with vitamin K that promotes blood clotting, so in case of thrombosis, it's better not to eat much of these herbs. Nettle. Have you tried the delicious nettle soup in the spring? However, in case of high blood pressure, it's better to choose light vegetable soups since nettle is full of vitamin K that increases clotting. Sugar. Great amounts of common sugar are contained in sweet soda drinks, bread, confectionery products, and many other foods. Sugar increases glucose levels and speeds up lipid synthesis, so the risk of thrombosis increases after every eaten gram of sugar. Fat and fatty foods. Cheese, butter, meat, and lard are all trans fats and fatty acids. Fast food should be completely eliminated from the diet as it contains tons of sugar and bad fats. When the blood is too thick, you feel fatigue and sleepiness throughout the day, even in the morning. The other symptoms are bad memory, lack of energy, and oxygen starvation. If you have thick blood, you're at greater risks for blood clots in your veins and arteries. Blood clots in your veins will affect the blood flow to the key areas of your body. Without a sufficient blood flow, tissues cannot survive. If you think you may have a blood clot, seek immediate medical treatment. And now let's have a look at the top 8 foods that will protect you from thrombosis and atherosclerosis. Turmeric. People have long used the golden spice known as turmeric for culinary and medicinal purposes. The active ingredient in turmeric is curcumin that has anti-inflammatory and blood-thinning or anticoagulant properties. A study published in 2012 suggests that taking a daily dose of turmeric may have a long-lasting anticoagulant effect on the blood. You can add turmeric to curries and soups or mix it with hot water to make a comforting tea. Ginger. Ginger is another anti-inflammatory spice that may stop blood clotting. It contains a natural acid called salicylate. Aspirin, or acetylsalicylic acid, is a synthetic derivative of salicylate and a potent blood thinner. To get the anticoagulant effects of natural salicylates, regularly use fresh or dried ginger in baking, cooking, and making juices. It's unlikely, however, that natural salicylates are as effective as blood-thinning medications. A 2015 analysis of 10 studies also suggests that ginger's effects on blood clotting are unclear. It indicates that more research is needed to fully understand the potential blood-thinning properties of ginger. Cinnamon. Cinnamon contains coumarin, a powerful blood-thinning agent. Warfarin, the most commonly used blood-thinning drug, is derived from coumarin. The Chinese cassia cinnamon contains a lot more coumarin than Ceylon cinnamon. Taking coumarin-rich cinnamon on a long-term basis can, however, cause liver damage. It may be best to stick to small amounts of cinnamon in the diet, in addition to using other natural blood thinners. Cayenne pepper. Cayenne peppers are also high in salicylates and can act as powerful blood-thinning agents. It's quite spicy, however, and many people can only tolerate it in small amounts. Capsules containing cayenne pepper are available in many health food stores. Other benefits of the spice include lowering blood pressure, increasing circulation, and reducing pain sensations. Red fish. Omega-3 fatty acids are among the best cholesterol-lowering agents. Fish oil, salmon, and pink salmon will reduce the rate of blood clotting and provide good prevention against thrombosis and atherosclerosis. Red wine. Of course, an excess consumption of alcohol drinks is harmful and dangerous, but about 100 milliliters of red wine in the evenings will protect you from heart diseases and vascular clogs. Wine has strong blood-thinning properties, so you can let yourself drink a small glass of wine in the evening in case of high viscosity. Vitamin E. Vitamin E reduces blood clotting in many different ways. These effects depend on the amount of vitamin E a person takes. The National Institutes of Health's Office of Dietary Supplements suggests that people who are taking blood-thinning drugs should avoid taking large doses of vitamin E. Garlic. Besides its unique and recognizable taste in food and cooking, garlic has natural antibiotic and antimicrobial properties. Some research reports that odorless garlic powder demonstrates antithrombotic properties. An antithrombotic agent is a substance that reduces blood clot formation. The American Academy of Family Physicians nonetheless recommend that people stop taking high doses of garlic 7 to 10 days before a planned surgery because of its antithrombotic properties. So how to maintain the good condition of the blood and prevent blood clots? Many natural substances may reduce clotting to some degree, but natural remedies are unlikely to be as effective as blood-thinning drugs, and people at risk of blood clots should not use them instead of prescription medications. Government authorities do not monitor herbs and supplements as closely as food and drugs. You should carefully research the different brands before buying to make sure they are known for quality and purity. People taking prescription blood thinners should not use natural remedies without talking to their doctor first. Even though they are organic, some substances in foods may thin the blood too much, especially when taken in conjunction with medications. This can increase the risk of bleeding. That's all we wanted to tell you today. On Big Progress, you will find videos about the benefits of various vegetables and fruits, information about diseases and how to cure them, and many other interesting facts about gardening and housekeeping. So make sure to subscribe to the channel and ring the bell, like the video if you've learned anything new, and share it with your family and friends. See you soon!